Diet and nutrition play a crucial role in the overall health and well-being of people on dialysis. The following are some key considerations for diet and nutrition for people on dialysis. Fluid intake. Patients on dialysis must limit their fluid intake to prevent fluid buildup in the body. The amount of fluid allowed per day is based on each patient's individual needs and is usually monitored by a healthcare professional. Protein intake. Dialysis patients require more protein than the general population to maintain muscle mass and prevent malnutrition. However, excessive protein intake can increase the workload on the kidneys and cause further damage. A dietitian can help patients determine the appropriate amount of protein for their needs. Sodium intake. Dialysis patients should limit their sodium intake to help control blood pressure and reduce fluid retention. This includes avoiding processed and packaged foods, which are often high in sodium. Potassium intake. Patients on dialysis may need to limit their intake of high potassium foods, such as bananas, tomatoes, and potatoes, to prevent elevated potassium levels in the blood. Phosphorus intake. Dialysis patients often have elevated phosphorus levels in the blood, which can lead to bone disease. Patients may need to limit their intake of high phosphorus foods, such as dairy products, nuts, and beans, and take phosphate binders with meals to prevent absorption. Vitamin and mineral supplementation. Dialysis patients may need to supplement their diet with vitamins and minerals, such as iron, vitamin D, and calcium, to prevent deficiencies. Calorie intake. Dialysis patients may require more or fewer calories than the general population depending on their individual needs. A dietitian can help patients determine the appropriate calorie intake for their needs. Eating pattern. Patients on dialysis may need to adjust their eating pattern to accommodate their treatment schedule. For example, some patients may need to eat smaller, more frequent meals to avoid nausea during dialysis. Overall, a balanced and individualized diet is essential for patients on dialysis to maintain their health and well-being. A registered dietitian can help patients develop a diet plan that meets their individual needs and preferences.